Kevin, on a more serious note, as we get ready to celebrate Mother's Day, it's a time of the year where we start to think
Hmm.
about the health of our mothers, whether our own
Oh
mothers
yeah.
or
Oh
mothers that are in
yes.
our lives each and every day. And a lot of the health screenings that they go through are critical to keeping them healthy for years to come and preventing some major ailments that can have a negative impact on their health.
Yeah, as a male, I'm even curious about it, because it can affect us all, right? Mothers, sisters, siblings, significant others, spouses, and more. And you just want to be educated on it, and you want to see what resources are out there and available, just in case you have to spread that knowledge and information. So joining the Splash Live right now, talking a little bit more about mammograms with women and women's health from Henry Ford Hospital, West Bloomfield. Joining the Splash Live, we have Dr. Saul Nathanson joining us. Thank you so much for your time, Doctor.
Well, thanks for having me here.
Absolutely. So, what we are talking about essentially is breast cancer screening, mammograms. There was recently an article that came out from the U.S. Preventative Services Task Force that basically talked about should women under 40 get mammograms. Can you talk a little bit more about the significance of breast cancer screening and mammograms altogether?
Well, we need to firstly divide women into two major groups. Firstly, those who are at average risk, so that's most of the women. And then we need to think about women who are at higher risk for breast cancer. And those are women who have mostly family histories of breast cancer and or they have gene testing done which shows that they've inherited an abnormal gene. So we don't normally recommend mammography or any other breast screening below the age of 40.
Correct.
And this USPSTF study that or this report that you've been reporting, uh, really has changed because there's been a conflict between them and everybody else. That everybody else is the American College of Radiology, the Society of Breast Imagers,
Right.
and the Society of Surgical Oncology, the American Society of Breast Surgeons,
Mhm.
and the American Cancer Society. All of us have been saying forever that women with the average risk should start getting mammograms at age 40 and get it every year.
Right.
And the upper limit, there should be no upper limit, whereas the task force says that we should stop at age 74. So the change that has happened with the US PSTF
Hmm.
is that now they say, okay, before they were saying start at age 50 and have it every 2 years. Now they're saying start at age 40 and have it every 2 years.
Ah.
So we still think that women should start at age 40 when they have average risk, and they should have it every year. The main reason being that we can diagnose breast cancers at an earlier stage and save a lot of lives. The numbers that have been quoted of saving lives is about anywhere up to 40% if you have a mammogram starting at age 40 and you have it every year.
Mm.
So the US PSTF task force, which unfortunately does not have a lot of breast specialists in it, has been fighting this for reasons that I'm not totally sure about, but maybe it's because of they're thinking about cost benefits. So,
Ah.
so when you're looking at cost benefits, that may make sense, saving bucks, but we're interested in saving lives.
Absolutely. Absolutely.
That we think is more important.
Absolutely.
So
Yeah. And
you mentioned under 40.
mhm.
We think that every woman by the age of 25 should have a calculation, an assessment of her risk for breast cancer. And
Okay.
currently the guidelines state that if you have a more than 20% lifetime risk of getting breast cancer as a woman, you should start getting mammograms and other imaging modalities at an earlier age. What age? We think that 30 is a good time to start getting mammograms. Before the age of 30, mammograms are not all that valuable because women have dense breasts, and it's not easy to diagnose with the X-rays. But there are other ways to image, such as magnetic resonance imaging or MRI. So we usually start at age 25 with MRIs in women who are at higher risk.
That's interesting because I wouldn't think too much about obviously breast cancer and mammograms and things of that issue. Obviously, with me being a male, but like you said, it obviously is breast cancer is the second most common cancer among U.S. women. So it is a very common issue that we must start to tackle immediately. And like you said, if you are at risk, a higher risk, I think you said 20% or more of possibly getting this diagnosed with cancer, then you should start possibly getting screening even a little bit earlier. Just starting to go see a doctor or a specialist to find out a little bit more about this. Doctor, just from your perspective overall, what are some different factors that contribute to the variation in breast cancer incidence, especially amongst the different demographics of women? I know you mentioned possibly genetics. Are there any other factors possible?
Yes, we know that certain lifestyles and certain demographics, particularly women who don't have babies, or who start having their families over the age of 30, or who start having their menstrual periods at an earlier age, below the age of 12.
Hmm,
So we know that those are important factors that increase the risk. If we look at, there is a way of assessing the density of the breasts. Now, density means that when you take a mammogram, there is a way for the radiologist to look at these to say, okay, we have very dense breasts. So there is an association between breast density and increased risk as well. And there are a whole host of factors that add up like that. We know that if you drink a lot of alcohol every day, for example, there's an
yeah,
increased risk.
right.
For some reason, there's an increased risk if you smoke.
Hmm.
Uh, and we talk about lifestyle. There's been a lot of information that's come up recently that cross reacts with other factors in life. So, for example, exercise. Everybody talks about how important exercise is, but
Correct.
we now have definitive scientific evidence that exercise, vigorous exercise of more than 150 minutes a week, does decrease the risk of breast cancer.
Hmm.
So on the other side, if you're obese and you don't exercise and you have a poor diet and you smoke and you drink too much alcohol, those are all factors, even if you don't have a family history of breast cancer, or if you don't have a gene that predisposes you to breast cancer,
Right.
those are factors, lifestyle factors, that increase the risk of breast cancer.
Yeah, and that would be I, I don't want to call it common sense, but common sense is a common, but those are things that for the most part they even have labels to say there's warnings to consuming this alcohol and smoking and things of that nature. So they already tell you those type of risks, but then like you said, other things, the choices that you make in your diet, going to work out, those all could have an effect on your body and the cancer, the possibility of building up cancer in it. So, great information, doctor. We appreciate your time. Last thing, the main thing that I got from speaking with you today is the fact that there could be some conflicting information out there for people when they want to be educated on this. What are some credible sources, or where can they go if they really want to find out credible information, accurate information when it comes to preventative services for breast cancer, mammograms, things of that nature, doctor?
Well, the most obvious is speak to your doctor.
Right.
Doctors are all educated about this, and it's a good idea to do that. If you there are a lot of you can Google, go on the internet, go online, Google. The American College of Radiology has a beautiful, very simple cartoon
Hmm.
uh, that's easy, and it's done deliberately that way by them, to make it easy for women, even if you're not a genius, even if you don't, even if you're not a physician, you can look at this cartoon and it's very easy to see, steps 1, 2, 3, and 4, very easy to follow, very easy to see, and references that you can look up if you really want to go further and deeper into it.
Okay, great. And that's good to know. Thank you for passing that information for. And just last thing before we go, any for the future of breast cancer screening, anything that you foresee in advancement, what do you see for the future of screening for breast cancer in women in this industry?
There's been and I've been in the breast business for a long time. Women are not very happy to get mammograms. They do it many with their teeth gritted because it's a little uncomfortable. They blame me for being a male and having invented it, which I did not. But for years now, there's been a lot of research, and it's ongoing in terms of trying to find new ways to identify breast cancer early.
Mm,
Currently, mammography is the best. What we have uh, on the horizon, which is really happening around the country more and more, is instead of just having a regular mammogram, which takes about 15 minutes, there's now an additional component to that. It's called a contrast enhanced mammogram, where an IV is given, and it takes about another minute or so to get a picture, and the specificity and sensitivity of that test is much better than the 3D mammography that we've been used to using for the last decade or so.
hmm
So that's one thing. Ultrasonography, there's a lot of research going on and has been going on for a long time. There are lots of technologies that are being used that I won't get into in detail, but these are all in research labs and research places around the country and around the world.
Right.
So it's not standing still. There's a lot of effort to try and find easier and better ways to screen women.
100%. And as we start to, be more developed in technology and research and things of that nature, I only imagine the screening process will get easier. The information part will get easier, and distributing the information will get a lot easier also. Once again, Dr. Saul Nathanson from Henry Ford Hospital, West Bloomfield, joining us talking about mammograms and breast cancer screening right here in the West Bloomfield community. Thank you so much again for your time, sir.
Thank you very much, Kevin.